Good morning. If you have decided to study to become a professional hypnotherapist, keep watching our training videos about hypnosis. Hypnosis is a powerful technique with which you can help and improve the quality of life of a large number of your future patients. Remember, in the description of this video you can find a link to free training classes on clinical hypnosis. And also you can download your ebooks also free. Trance induction methods in direct clinical hypnosis. Tendis method. Part 1. Tendis stands for tension and distension. Jacobson discovered that by systematically tensing and relaxing various muscle groups, and by learning to attend to and discriminate the sensations resulting from tension and relaxation, a person can almost completely eliminate tension and relaxation. A person can almost completely eliminate muscle contractions and experience a feeling of deep relaxation. Building on the initial work of Jacobson and later Wolf, a whole range of variations of the original process began to develop. The state of affairs became so complicated that each author developed his own system of relaxation. This is easy to prove because if we look at any behavior modification manual, we can see a different relaxation method in each one of them, although at least they all have a parallel relationship. Whichever variant is used, the technique consists of the following. A. Once the patient is comfortable, he or she should begin to tense and relax muscle groups. B. When the patient tenses a muscle, he or she should try to notice in which particular area he or she feels the tension. It is very important that you get as much tension as possible, as much as you are able to achieve for each muscle group. C. You should then concentrate on what you feel when the muscles are relaxed. The sequence, therefore, is as following. 1. Tense the muscles to their maximum degree. 2. Notice in all the muscles the feeling of tension. 3. Relax, and 4. Feel the pleasant sensation of relaxation. When the patient tenses a particular area of the body, he or she should keep the rest of the body relaxed. The technique in Tendis is similar to Jacobson's in terms of tensing and relaxing the muscle groups, and feeling the sensations of stiffness and distension, but in our case, that is the only overlap. That is the only coincidence. The rest is totally different, both in the sequence and in the muscle groups. Nevertheless, I thought it would be interesting to include the reference to Jacobson's progressive relaxation to reinforce the sensation of tension and distension in each step of the sequence, because if this were not done, in my opinion, the sensations would possibly be too blurred due to the application of the technique itself. The above will be understood if we explain the development of the Tendis technique and bear in mind that it consists of A. First of all, we will divide the human body into 10 parts or muscle groups, which are 1. Feet. 2. Ankle to the knees, calves or lower legs. 3. Knee to hip, thighs or upper legs. 4. Hip, belly and thorax. 5. Back and spine. 6. Shoulders and neck. 7. Arms and hands. 8. Cheekbones and jaws. 9. Head and face. 10. All that is missing. B. Secondly, we will do an ascending stroke from 1 to 10, tensing each muscle group. C. Then we'll make a descending pass, taking into account that in the first 5 numbers we mentioned we have to distend or loosen our whole body, that given in the following way. 9. Face and head. 8. Shoulders up to waist, arms and hands. 7. Waist to knees. 6. Knees to the feet. D. From number 5 to number 1, we'll reserve it to focus exclusively on the breath. Thus, we'll observe the breathing and will accompany the words of relaxation at the moment when the patient expels the air. For example, breathe out, relax more. Breathe in, breathe out, relax more and more. Breathe in, breathe out, rest, rest, rest. Application. When applying this technique, the following recommendations should be taken into account. Do not tell the patient that we are going to carry out a relaxation exercise so as not to condition him or her, and so that we can carry out the tensioning step without any problems. Instead say, we are going to perform an exercise of tension and distension of the body. The position in which this exercise can be performed are as follows. 1. Lying on a bed or couch with arms and legs slightly angled away from the body. 2. A comfortable armchair with arms. In this case, it is advisable to use supports for the back of the neck and feet. 3. Sitting on a chair or stool. In this case, make sure that your back rests on a flat surface so that you cannot fall. Do not prolong the tension of the face too much, so as not to cause any problems. The face is therefore the last to tense and the first to relax. Recommend to let things happen and let yourself go with the process. Appeal to imagination and memory. Tell him to raise his shoulders until he tries to cover his ears. Ask him to tense the muscles of his right hand and forearm by clenching his fist, feeling the tension in his hand, knuckles, forearm. Development. Adopt a comfortable posture and a position that is comfortable for you. Arms outstretched along the body, hands loose and relaxed. Loosen the tension in the muscles in the arms and legs. Close your eyes and pay attention to everything I tell you. Relax until you feel at ease. To perform this exercise, you are going to have to use visualization and memory. We are going to perform an exercise of tension and distension of all the muscle groups that make your body. It is very important that you achieve as much tension as possible, as much as you are able to achieve for each muscle group. But you will never tense the muscles to the extent that they start to hurt. To do this, I'll help you by counting from 1 to 10. For each number I give you, you will tense the part of the body that I mentioned. First of all, you are going to focus on your feet. Focus your attention on your feet and tense the muscles in your feet. And to do that, stretch the muscles in your feet. And to do that, stretch as much as you can the tips of your toes, turning them inwards and curling them at the same time. The toes, tense your feet and feel the tension. Feel it very well. Tense the muscles enough to feel the tightness under the arc and on the instep of the foot. Now, focus on the calf muscles. From the ankle to the knee, you are going to tense the muscles as much as you can, pulling the toes upwards toward the head. You have to feel the tension. Feel that tension now. Feel it. Feel it. Feel it. Very good. You are going to tense the muscles that go from the knee to the waist. Pay attention to your thighs and tense them. Tense them in such a way that the muscles are hard, very hard, totally hard. Very good. Focus now on the hips, abdomen, belly and thorax. Tighten the muscles of the buttocks and the waist muscles by pressing the buttocks against the bed. Now tighten the muscles of the abdomen while pressing the stomach outward. Tighten the abdominal muscles as if you think you are going to hit it. Take a deep breath and at the same time bring your shoulders back and try to bring your shoulders blades to touch. With that, you tense your chest, your shoulders and your upper back. Feel that tension now. Okay, very good. Concentrate now on your back. Lean your shoulders against the mattress, back of the chair. Bend your spine in such a way that you feel the tension. Very good. Now move on to your shoulders and neck. Start by stretching and lifting your shoulders, as if you want to cover your ears. As you tense your neck, pressing your head hard against the bed or chair. Now, direct your attention to the muscles of the cervical region. Lean your head forward, press your chin against your chest, and be aware of the tension this produces in the nape of your neck. Bend the elbow and tense the muscles of the arms. Increase the tension and control the sensation of tension in the arms. Increase the tension and control the sensation of tension. Tense also the muscles of the hands and forearms by clenching the fists. Slowly but firmly increase the pressure. Now you should be able to feel the tension in your hands, in your knuckles, in your forearms. Feel the tension. Clench your fists tightly, tightly. Clench your teeth tightly and tense your jaw muscles. Feel the tension in your jaws. Feel the tension as you clench your lips tightly and feel the tension in your cheekbones. Now feel your head and feel the tension of all its muscles. Wrinkle your eyebrows. Tense them by raising your eyebrows as much as you can. Do it with more strength. And feel the tension of your face. Totally tense. Finally, pay attention to your whole body. Pay attention to your whole body and tense whatever you have not yet tensed. Tense it. Tense your body. Very good. Now that you've got your whole body tensed and stretched, you're going to start to relax it little by little as I tell you. You're going to feel the difference between the unpleasantness of tension and the pleasant pleasure of relaxation. If you're interested in learning more about clinical hypnosis, watch the following video: Trance Induction Methods in Direct Clinical Hypnosis, Tendis Methods, Part 2. Remember the description of this video where you can find a link to free training classes on clinical hypnosis, and you can also download several ebooks also free. If you have any questions, add them in the comments area. On this topic and many others we'll talk about in the channel and in the videos that we'll publish. So if you're interested, do not miss our next videos. Thank you very much.